They're the heartbeat of our health system. And this July, Jamaica shines its spotlight on our healthcare champions. Hi, I am Kediesha Watkis, and this is the Wellness Beat. It's Healthcare Worker Appreciation Month, and under the theme honoring service, commitment, and sacrifice, we're saluting those who make wellness their mission. My guest this time around is our Chief Nursing Officer inside the Ministry of Health and Wellness. Her name is Mrs. Patricia Ingram-Martin. Welcome to the show, CNO. We're so happy to have you.
Thank you so much. It is indeed a pleasure for me to be here.
Excellent. And you are doing so much inside the ministry, coordinating the nursing and midwifery program all across the island. Congratulations on all your hard work.
Thank you so much.
Excellent. So Chief Nurse, I am interested in your background. It's been over 25 to 30 years. What inspired you to get involved in the nursing field?
Yes, thank you so much for that question. It is indeed over 30 years that I have started nursing, my nursing career. But what really inspired me was that I had this inner compassion, to care for people and animals, I must say. As a matter of fact, it started with animals, because where I grew up, we had animals around: dogs, cats, goats, pigs. And anytime there was an injury, I was the one who would move towards them and to take care of them, nursing them back to health. And then from then, the passion grew, and it became a human thing now. So I decided to go into nursing, where I can care for human beings, nurse them from illness back to health.
Yes, so you have been exhibiting that nurturing nature from an early age.
Certainly.
I love to hear it. And I mean, as you are here reflecting on your experience, what have been some of the most fulfilling parts of your jobs? I know you were extremely instrumental in our management of the COVID-19 pandemic with our nurses and our midwives. Take us into the journey, the most fulfilling parts of being a nurse.
Well, I can say it started out at the Victoria Jubilee Hospital, where that was where I started. And the most fulfilling part is really to give that support and to care for women who were in labor, and to care for them after their babies were born. Not only them, but their families. And I can tell you, it is indeed a very fulfilling experience when you put that mother, that baby, to mother, give that baby to mother, right after birth. So those are some of the very fulfilling experiences that I would have had, making sure that everything is okay with mommy and baby as much as is possible, and then for them to unite at the end. So, that is one thing. Coming further into Bustamante, I did work at Bustamante Hospital for Children. Just seeing the children coming in. Sometimes they're in their mom's arms, very limp, and then we care for them. Sometimes we have to resuscitate them and to care for them in the critical care unit, intensive care unit, and then to see them bounce back and walk out of hospital. That is a very fulfilling experience. And then in the Ministry of Health, where I am now, just being a part of the policy making process, being a part of the decision making process, it is indeed a fulfilling experience, and especially when it has to deal with nurses and midwives.
I love to hear it. Compassion and care are a part of the job, no matter where you're serving.
I know.
And I can hear it coming out in your story. Chief Nurse, we are at a critical juncture in terms of our human resources for health. And I know that the nursing field is one of those areas that we are zooming in on. Help us to understand what's happening in terms of our human resources and getting our nurses into the health system. Are there specific areas that we may have a shortage or that we're looking to ramp up?
Okay, so in nursing and midwifery in Jamaica, right across all areas, we do have shortage. For our general care nurses, we do have shortage of those in the institutions. They are trained at the universities, but we do not sponsor their training, and so we do not have any hold on them in the system, so they may decide to go to greener pastures if they wish. For our specialist nurses, however, we do have the training facility here in the Ministry of Health for them, where we train 8 categories of specialist nurses, and then we have another 2 that we sponsor for training at the University of Technology. Okay. Although we are training and we are continuously training, persons are leaving the system, and they leave for various reasons, some because of economic reasons, some for other personal, or they have a very varied number of reasons why they leave. Right. But as it relates to the specialty, I can just give you a little sneak peek as to what is happening with us now. So as at December 2024, we had 1,108 specialist nurses, and these are right across the different services. We need, however, 2,496. So that means there's a gap of 1,388, and these are all categories. So we're talking about our midwives. I spoke to you a little bit about, me being a midwife and helping at Boston and at Victoria Jubilee Hospital. So, the midwives are those who care for mothers during pregnancy, they do the deliveries, and they care for them after. Now, for those, we need over 385 of those persons. Wow. For our emergency nurses, those are who work in the accident and emergency department, and they help with triaging to see who needs to see the doctor more urgently, and also to initiate some care before they see the doctor. For those persons, we need over 300 of those persons. We're talking about critical care nurses who work in the intensive care unit. Those are the ones who care for the critically ill babies and adults who are in the intensive care unit. We need over 200 of those persons. So right across all the specialities, pediatrics, neonatology, and all the specialities, we do need nurses, specialist nurses. As I said, over 1,000 of them we need right now.
And I'm so glad that you gave us that breakdown, because sometimes we may see our nurses not understanding the varied roles that they play, the different departments or areas in which they may serve. We may just heap them all up into a category, but we're saying we need emergency nurses, we need neonatologists, we need pediatric nurses,
we need cardiac care. Those are the heart. They work in the units where we have those heart conditions. Ophthalmology, which is the eye. We need all of those specialist nurses. Now, the specialist nurses are those who they would have been registered nurses before, but they would have had additional training, advanced training in these services, to make them be able to care for those patients, through all situations. They're zeroing on those and would have that holistic care for them.
And so I am interested in the plans that are afoot. I know that we have plans to address this shortage. What can you tell us about those plans? Okay,
so nurses leave the system for different reasons, as I had said before. And so we tend to look at some of the reasons why they go. Leaving. And for example, persons may say that they are not comfortable in their workspaces. But as you know, the ministry is now planning, and they are engaged in revitalizing some of the services and even the health centers, to do construction work and to make sure that they these areas are suited for not only the workers but also for the patients. So they will make sure that, you know, we do have the necessary equipment and supplies that are available for our nurses and midwives and also other workers to be in. So we look at those working conditions and conditions of work.
Yes.
Now, another thing that we're looking at is that nurses leave sometimes because they say they are burnt out. The nurse to patient ratio is high, and so because we don't have many of them, you find that one nurse has to care for a lot of patients. So we're trying to do recruitment of nurses. We do have bilateral agreement with the Cuban government, and that continues. We also have just forged a partnership with the Nigerian government. As a matter of fact, as we speak, some Nigerians should be coming to the island this afternoon, you know, to complement the team that we have. And we also are in discussion with other countries, you know, to see how we can get our nurses.
Yes.
Because nurses go.
Come and
while
go.
we try to keep them, as I say, they have their various reasons why they go. So we have to continue to make sure that we train. That's another point. We have our nursing, the nursing school, the specialist nursing school, in service
unit.
Yes. And we do those specialist training. We make sure that they are equipped to train as many persons as we can, but we do not have the capacity to fill the gaps that we have now. And so this is why we have to seek external help for our nurses.
And so there are several measures being taken. We want to refresh the environment, make sure that staff welfare is continually prioritized. And we are looking at training, ramping up that upskilling, as well as looking to our bilateral partners. And as we are wrapping things up, Chief Nurse, there may be those watching the program and they're contemplating a career in nursing. I'm going to give you just 30 seconds or less to give your best advice to those who are watching.
So I would want to welcome all who wants to come into nursing and midwifery. It is a caring profession. But one of the things I want to say to persons, you know, you have to examine yourself and make sure this is really what you want. Because sometimes caring is not easy and you have to give yourself. So you have to be prepared for this, else you will frustrate yourself. So think about it carefully, and if that is what you really want to do, come on in. We welcome you with open arms. You know, it is satisfying, and there are a lot of, you know, you feel so rewarded and satisfied at the end when somebody can say, thank you, nurse. When you see somebody who came in very ill walk out of the hospital, it can be very satisfying. So I would want to welcome persons into the field, and we ask that when they come, that they stay with us for a little while, you know, not just to come and run away again, but to stay with us and, you know, give your service to the country. You know, we do need you in the professions.
Right. And that is an excellent way to wrap up this part of our episode here on the Wellness Beat. We're spotlighting our healthcare champions, and we've been talking with Chief Nursing Officer for the Ministry of Health and Wellness, Mrs. Patricia Ingram-Martin, talking about the critical role of our nurses. And her message is what? Stay with us. We need your service. I'm going to also ask you to stay with us, because on the other side of the break, we have some more critical information, especially for those who may already be in the crop of those being trained in the nursing field. We're going to take a look at the Dr. Barry Wint Memorial Scholarship and what it has to offer. Thank you so much, Chief Nurse, for being with us.
You are most welcome.
Big dreams and bold futures. Now a $1 billion boost to help make them possible. We're talking about the Dr. Barry Wint Memorial Scholarship. Thank you for staying with us here on the Wellness Beat. And my guest on the second side of this segment is Stephen Davidson, Director of Public Relations and Communications. He's going to be sharing with us about this year's Dr. Barry Wint Memorial Scholarship. Welcome to the set. Welcome to the program, Stephen.
Thank you.
Good to have you. So the Dr. Barry Wint Memorial Scholarship is now back in its second year. Talk to us about the scholarship. What inspired its creation?
All right, so it's a commitment of $2.5 billion over 5 years, so that's $500 million per year. And what we see happening, of course, is a shortage of healthcare workers, not just in Jamaica, but across the globe. There's a high demand for healthcare workers, and so we want an opportunity to kind of plant the seed and foster the growth and development of our human resource, and to create more healthcare workers so that we can fill that shortage and fill that gap at this time.
Right, and I know the scholarship was named in honor of former Chief Medical Officer Dr. Barry Wint. Yes.
Right, so yes, of course, it's a scholarship that is for health-related persons in the health-related field.
Right.
And so in honoring an outstanding stalwart, you know, we named that scholarship in his honor.
Yeah, and so help us understand how this scholarship program aims to reshape the future of healthcare here in Jamaica.
Right, so what we are seeing, of course, in the population is an aging population and the changing needs and lifestyles of our population, and we must respond to that. So
right.
We aim to have, you know, longer opening hours, more facilities are being rebuilt and being built, new ones are coming on board. And so there is a greater demand, there's an increased demand for more healthcare workers in all categories. And so it will allow us to have that homegrown base. So we have to rather, you know, have that's groundswell,
yes,
rather than importation. So what we're doing with this scholarship is fostering the education of our young people, the generation coming up, so that they can fill those slots in the public sector.
Right, and you know, I just had a talk with our Chief Nursing Officer, Mrs. Patricia Ingram-Martin, and she took me through a list of those specialty areas, the nurses that we need, the midwives, pediatric nurses, neonatologists, and so on. And so I see where you're going with this scholarship program. Tell us about any other areas that are being targeted for intake, the specialties and other fields.
Right, so we welcome all applicants who are studying health-related fields, but we are zoning in on this year on dental nursing therapy, biomedical engineering, epidemiologists. We are looking in terms of nurses, we're looking especially for 3rd and 4th year students who are studying nursing and midwifery. So it's really the specialist areas that we want. There's a whole list that persons can go onto our website and see that list that we're trying to zone in. So based on the forecast of the needs that we would have in the future,
yes,
we're trying to foster that.
And I'm glad to hear that, because I know whenever we say the term healthcare workers, many people automatically think just about our doctors and our nurses, but we're saying we need engineers, we need those skilled in radiation therapy, we need, what else? Other kinds of dental nurses, speech therapists.
Right.
They are all health related fields. And so not just our doctors, we love our doctors, but we have to cast our net wide. And so I'm glad that this scholarship is responding to that. Now, there was an overwhelming response to the scholarship last year, and I'm anticipating that the response this year will be just the same. Walk us through the application process and any other details that candidates need to be aware of.
Okay, so the scholarship is now open until July 18th, and so we welcome all applicants, and we're making it easy. You don't have to go anywhere, just do it online. So visit our website, moh.gov.jm/scholarship, and you get to create a profile for yourself, and of course you upload your documents. So your transcript, your recommendation letters, your financial statements, your acceptance letter. Once you've gathered those, your references, once you've gathered those, you go on the website, create a profile, you submit them an essay as well too. We require an essay. And so the checklist is there. So once you have gathered those documents, then you submit them, and you will hear from us in August, because school starts shortly thereafter.
Yes, yes, yes. And so this is a life-changing scholarship that we know is paving the way for the next generation of healthcare workers. I know a lot of persons don't like to hear about the bonding part, but we know we want our healthcare workers to stay, and that is a part of the program as well. Anything further from you about the scholarship?
Well, we just want to encourage all persons who are willing and able to apply for the scholarship to make use of this opportunity. It is $1 million for up to 5 years per applicant. And we know a lot of times studies will cost you, and one barrier to entry is really the fees. And so we want to assist you in that part by covering the tuition and other fees. Can you imagine getting $1 million for up to 5 years to complete your study? And of course, it's not limited to undergraduate, it's both graduate and undergraduate students who are welcomed.
Excellent. Thank you so much, Stephen, for sharing with us. I'm looking forward to hearing about all the excitement about the Barry Witt Memorial Scholarship this year. Thank you for joining us.
Thank you.
Well, there you have it. We're paving the way for the next generation of healthcare champions. And I'm so glad that you're able to listen and watch while we talked with our guests on today's program, Mrs. Patricia Ingram-Martin, Chief Nursing Officer, and Stephen Davidson, Director of Public Relations and Communications. Want to get involved in healthcare? Apply to the Dr. Barry Witt Memorial Scholarship. And that's how we wrap things up here on The Wellness Beat. I'm Kediesha Watkis. Thank you for watching.